Good afternoon, Dr. Erica McIntosh. This is my case presentation um, for both my job and internship, Interfaith Shelter Network. For SWK 581, that's due March 22nd, 2024. IFSN, also known as, or I should say Interfaith Shelter Network, also known as IFSN. Interfaith Shelter Network has been moving people out of homelessness in Sonoma County since its inception in 1989. Excuse me. We do this by empowering families and individuals who are experiencing homelessness by providing them with rapid rehousing, transitional housing, and a range of services that include tenant counseling, financial assistance, education, free psychotherapy for their life and their family, and case management. The mission statement for IFSN is providing housing and a hand up for homeless men, women, and children in Sonoma County in an atmosphere of dignity, respect, kindness, working towards an outcome of empowerment, self-sufficiency, and independence. The vision statement for IFSN is IFSN strives to empower families and individuals experiencing homelessness by providing housing, needed tenancy, education, resources to stabilize the clients in their homes, thus strengthening our community. Case conceptualization or description. John Doe is a 43-year-old Anglo male. The information was obtained in session, collateral information from intake reports, person-centered plan, and other intake reports from probation and pretrial assessments that were done in jail, as well as a biopsychosocial, weekly reports, and weekly clinical notes. The client has a history of homelessness and a DV charge currently. Client is on pretrial probation, and he will move towards mental health diversion, which is where his charges will be dismissed after he completes that program. Client grew up in a home where the father and mother were committing domestic violence on each other. The home was toxic. He and his siblings experienced abuse and violence daily. Client has a HX of methamphetamines, alcohol, and opiate abuse. Client has a past history of SI and further states that his procrastination, anxiety, and frequent depression date back 10 years from history of abuse, being homelessness spanning years. At that time, the client was using drugs, sleep deprived. Client wishes to go back to school to improve his time management and coping skills dealing with anxiety and depression, PTSD, OCD, and quite a few other things. Client has a past history of trauma. The client currently has no SI or HS feelings. The client, 43-year-old male, lives in Northern California. History of violence starting in high school, getting worse as he entered high school and then college. The client's primary language is English. Sorry. Parents divorced while the client was in high school. Client graduated from high school, and the client has spent a few years in college, but never finished. Client wishes to return to college and attend a local JC, get his associates in social work with emphasis in dual recovery and rehabilitation. The client owns his own trailer that is parked on family land. The client is going to DAC currently, which is an outpatient program, attends AA and NA meetings. Client has been sober and drug-free for 12 months. Behavioral learning theory is a school of thought that believes humans learn through their experiences by associating a stimulus with either a reward or punishment. The client learned that consuming alcohol and drugs allowed him to feel no pain. Instead, the substance abuse made him feel good and allowed him to cope with life during short periods of time. The family dynamics, again, are the client and siblings now have minimal contact with the biological mom and dad. There was physical abuse and domestic violence in their home when they were children. Mother and dad have a history of substance abuse, but the client cannot remember if the mom or dad has mental health issues. There is a history of incarceration and legal issues with the client. Mom and dad Yeah, mom and dad have a history of substance abuse, but no mental health that the client can remember. Client experienced psychological abuse from biological mom and dad, and both parents were physically abusive also. Um, Client has flashbacks and trauma related to physical abuse. The client has symptoms including substance abuse, current and past, sleep issues, OCD, and ADD. The client has flashbacks dealing with, daily depression and low self-esteem. The assets, strengths, and liabilities are that the client has been sober for 12 months, is compassionate, empathetic with others, and is able to control temper. The client does have impulsivity issues which has also been created legal problems in the past, prior charges. The client current legal problems have him on pretrial probation that will move to mental health diversion, then charges dismissed. Client has been sober for 12 months, attends AA, Celebrate Recovery 3 times a week, and NA also. The client is working the 12 steps AA and NA Big Book with a sponsor. Changes that the client wants to make. He wants to change his eating habits, eat better, that will help him improve his mental health. Prayer and mindfulness and meditation on a daily basis. He didn't do that in the past, but he definitely wants to change that. The client is not trusting himself and others. He also wants to change that. Resources, AA, NA, weekly recovery meetings, prayer, mindfulness, meditation, weekly therapy, and group therapy. System theory. According to the systems theory, a system is made up of previous elements that affect the behavior. Family of origin, meaning parents, friends, and workplace, social status, the home environment, and other factors that impact on how someone thinks and behaves. Attempting to replace any missing or ineffective components of that system may assist to change the person's behavior. Of course, the opposite is also true. In this instance, the client was using drugs and alcohol, which is a dangerous behavior. It was discovered after looking into his surroundings that he and his siblings have minimal contact with their mom and dad. The client comes from an abusive household. The client suffers from addiction, which the client will use to cope with childhood trauma. The client does have emotional support with siblings and extended family. The diagnosis are major depression, moderate single episode, ADD, alcohol abuse, OCD, PTSD, methamphetamines, and opiates. Okay, Google, stop. Okay, Google, stop. The client will receive weekly CBT therapy, positive psychotherapy, and SFT. This will help the client address the depression, past self-harm issues. The client will receive individual weekly therapy along with group therapy. Client will have take-home assessments that will include deep breathing, meditation, and help the client better cope with anxiety, depression, OCD, PTSD, and ADD. The current plan will be reviewed in 2 weeks. Current plan will also include relaxation therapy, meditation, centering that will address the symptoms of anxiety and depression. SFT, help patients recognize time when their symptoms or issues are not problematic and they are able to move past tough times. Focus on patient strengths, affirm that they can do anything they set their mind to with God's help. Help patients identify the thoughts, feelings, and behaviors associated with their symptoms. Helps patients identify more productive thoughts and help them better cope on a daily basis. Motivational interviewing and positive psychotherapy address patients' stages of change, use open-ended questions and reflective listening, help patients engage in activities that have been shown to better well-being, i.e. mindfulness, acceptance, and forgiveness, and most of all, service to self and others. Create a treatment plan with patients' engagement and make small steps towards in betterment. Client's motivation: remain sober, get a job, live a stable life, and get, continue to use his self support systems and do therapy, both individual and group, and live, a new, stronger life and grow with his relationship with the Lord. Client will receive, summary of treatment method and other considerations. Client will receive motivational interviewing, SFT, CBT, and positive psychotherapy, helping the client lessen his anxiety and depression on a daily basis. Client will better be able to manage his sadness, anxiety, OCD, and ADD, PTSD. Current plan is individual therapy, group therapy, take-home assessments, including deep breathing, meditation, relaxation therapy also. In 2 weeks, the plan will be reviewed, making sure the client's happy with it. Anxiety and depression symptoms will be addressed through relaxation treatment, meditation, and centering. The application of motivational interviewing, SFT, and CBT will be essential practitioner skills, which I have. Weekly individual therapy sessions are ongoing. The object is to help the client maintain sobriety and maintain relationships with sponsor, mentor, other family members, and team members. Client is Catholic, and their case management will include discussions about weekly treatment sessions. I actually don't do the case management. It's done by another person, but we collaborate. The client is doing well and the effectiveness is ongoing, but every appointment includes a strategy. And that is it. Thank you.